Hello, everyone. Welcome to our August webinar on integrative medicine, combining the best of conventional medicine and other evidence-based therapies. I'm Paige Kennan, a programs manager here at Can Do MS, and I want to thank you all so much for being here with us this evening. We also want to thank our sponsors who allow us to continue to do this programming for free. I'm happy to introduce our panelists today. We have psychologist Roz Call, Dr. Terry Walls, a clinical professor at the University of Iowa, go Hawks, and nurse practitioner Megan Weigel. Roz, will you please get us started?
I will. I'm so glad all of you are here. Here are our learning objectives that we have for the group. We hope when you leave, you'll understand integrative medicine, what it means, and what its relationship is to other types of care, including your MS care. That you've become familiar with evidence-based wellness strategies that you can take charge of yourself, related to diet, to stress management, to getting restful sleep, and integrating exercise and physical activity into your day. And we hope that you'll learn tips for being an educated consumer regarding the components and providers of integrative medicine.
So let's get some terms straight. There is clearly a lot of variability in the ways that we talk about integrative medicine. And I really like this slide because it kind of evens the playing field for, not evens the playing field, it gives us a pole, and by pole, I mean P-O-L-E, of one side of the spectrum to the other. So conventional medicine or allopathic medicine is the medicine which your healthcare providers that you see for your specialty care are trained under. It's disease-focused, treats symptoms using drugs, radiation, and surgery, and it really serves as the knowledge base for Western medicine. And conventional medicine, by and large, has served us very well for things like acute illnesses, trauma, infection, and preventive care when preventive care is done sooner than it needs to be done. And that's been a challenge in conventional medicine because of insurance restrictions. Now, alternative medicine is used in place of conventional medicine. It treats symptoms using medications that are closer to nature or natural, so using supplements, maybe. And not all treatments are scientifically validated. And it also might be alternative medicine forms that are not supplement-based, but rather energy medicine-based. And so a couple examples of alternative medicine would be, in MS, would be having bee sting therapy for MS, or seeing a Reiki provider to heal from some anxiety or any energy block that you have. Now, complementary medicine uses both conventional and alternative medicines to diagnose and treat symptoms. It's kind of a hybrid. It's a more modern approach. Integrative medicine combines everything to the left and uses it together to provide the most, what I consider to be the most valuable, broad-based type of treatment plan for a patient. But the emphasis is on evidence for that condition. So as an integrative medicine provider, I can tell you what there's evidence for certain symptoms in MS and what there's not evidence for. Functional medicine is now, the Institute of Functional Medicine has changed their paradigm a little bit in such that they are wanting more to work with conventional medical providers. But the system is based in systems biology, which focuses on prevention rather than treatment. And so our bodies are made up of systems. Systems are things like your energy system, your metabolism system, your hormonal system, your elimination system. And so functional medicine focuses on making sure those symptoms are working well together versus conventional medicine that is like, well, let's look at your liver's over here. Let's look at your kidneys, just kidneys over here. So functional medicine is a little bit more integrated as well. Not necessarily as much evidence in humans as in animals, but the evidence in humans for some of these interventions is rising. So what we're going to talk about today, and we hope that you leave with, is that we're really focused on giving you opportunities to take back control of your multiple sclerosis. So we want you to pay close attention to things that are under your control, like your nutritional health, your ability to use physical activity and exercise and movement of your body to stay healthy, no matter what your ability level is, sleep hygiene, opportunities to manage your stress and various techniques for that, and then MS disease and symptom management options. And these are all things that are under your control. They give you back the power, empower you to make healthy decisions and implement healthy changes in your life so that you live better with your MS.
Okay, let's talk about food. And I am just so excited that we have this network meta-analysis that looked at 12 studies, 8 diets: low-fat, ketogenic, Mediterranean, anti-inflammatory, calorie restriction, paleo, which is basically also known as the Walls diet, time-restricted, intermittent fasting, and usual diet. And we're able to analyze that data. And we saw that there are 3 diets that had really the best outcomes. The Paleolithic, low-fat, Mediterranean, best for fatigue, and for quality of life, it was Paleolithic and Mediterranean. And I think the question that I tell my patients is, I want you to stop eating the standard American diet and work to improve your diet. And if one of these diets speak to you, whether it's the low-fat, ketogenic, Mediterranean, paleo, intermittent fasting, do that. And if you can do it as a family, that is a great next step. And there we go. So, and the other thing I want all of you to know is your primary care person can help you with this. If they aren't excited when you come in and say, I want to eat more vegetables, I want to eat less junk, and I would like some help, fire them and get a new one. So your primary care should be thrilled to help you improve your diet. And if they aren't, fire them and get a new one. And they're out there. You could also ask for a referral to registered dietitians. They can help you improve the quality of your diet. They may talk with you about the dietary guidelines for Americans, and that's a very good diet. It's very similar to a Mediterranean diet. You can also ask for a referral to a mental health professional. If you are struggling with some food addictions, if you know that you have some emotional baggage that's driving your poor eating choices, and there are a variety of integrative health professionals that are very focused on diet, and they can also be a tremendous source of support. However, whatever you do to improve your diet, you'll be much more successful if you do it as a family. And I encourage you to focus on the things you add first: more non-starchy vegetables, some good protein, and then that will hopefully crowd out the poor choices. And
So I was sitting at the Consortium of MS Centers annual meeting in a seminar that Dr. Walls was moderating. And one of her students posted this slide. And so this was an article that was written in the Journal of the American Academy of Neurology. It was published this year. And these are very important words for neurologists to read and neurology providers, because many of you, I'm watching things in the chat, many of you have known the benefits of eating healthy in MS for a very long time. And many of you have heard from your neurologist, well, eat a Mediterranean diet, but there's not much more guidance. And many of them don't know the evidence. So read these words in yellow with me. Taken together with the results of this NMA, which is meta-analysis, nutritional meta-analysis, there is sufficient evidence to recommend a healthy diet as an adjunct intervention in MS. Clinicians can promote a healthy diet by referring patients to a registered dietitian. I want to go back to the second part of that sentence. There is sufficient evidence to recommend a healthy diet as an adjunct intervention in MS. That means that your MS provider should be talking to you about the importance of nutrition. I got goosebumps.
Me too.
So let's move on to exercise and physical activity. I had the opportunity recently to author a paper with a team of experts in exercise and physical activity from all around the world, and I learned a tremendous amount. But what we know from that multidisciplinary team that worked on this set of recommendations is that you can get help if you're struggling to figure out how to exercise, how to be more active, what to do, and how you can do it regardless of your ability level. So physical therapists, occupational therapists, exercise physiologists, and other exercise specialists, and even mental health providers can help. And as a mental health provider myself, one of the ways that I get involved with people is to help them figure out how to motivate themselves to make changes in behavior. That is difficult, whether it's changes in nutrition, changes in sleep habits, changes in exercise and physical activity. Sometimes you need to work on your goal setting and motivation first in order to take the steps to increase your health behaviors in other areas, including exercise and physical activity. So fasten your seatbelts. The recommendations that came out of this paper and several other papers related to exercise for MS and also for the general population are to get 150 minutes per week of exercise and or physical activity geared to your abilities. And while 150 sounds like a big number, keep in mind that you can do your exercise and physical activity in really small bites, 5 minutes here, 10 minutes there. And in fact, one of our favorite PTs, Mandy Rohrig, has exercises for you on the Can Do website. I'm sure Paige will put that in the chat where you can do some exercise shorts with Mandy, learning how to build them in while you're cooking in the microwave, while you're waiting for a red light, while you're waiting for the elevator to arrive, or anything else that's a short bit of time in your life, you can incorporate activities. And why is it important? Because it turns out that exercise and physical activity help everything. It reduces fatigue, which we know is so common in MS. It also reduces those other health conditions, which are common in people living with MS, and which we know from some really wonderful research actually speed disease progression. So when you reduce those comorbid health conditions, you also can help slow your MS progression. We know that exercise improves mood. Those endorphins are really powerful, and we get them when we raise our heart rate and work out a little bit. There's also some evidence that it may improve cognitive function, although I was just reading this week that some of those data have been called in question. So we're going to have to wait more to see about the impact on cognitive function. But I know that when I exercise, I just feel better, stronger, more able to take on the challenges of the day, particularly as I get older. And I'm also aware as I get older that the exercise I do for strengthening and balance helps to reduce my fall risk. And oh, by the way, we have an upcoming program on coaching around reducing your risk of falls, which maybe will also magically appear in the chat.
I love that I get to present the evidence on all of these really good things that we're telling you to do. So again, an article published in peer-reviewed medical literature, current neurology and neuroscience reports in 2019 shares that based on recent evidence, a new paradigm shift is proposed, in which exercise at an early stage should be individually prescribed and tailored as medicine to persons with MS alongside conventional medical treatment. As Roz said, other medical comorbidities, vascular comorbidities like high blood pressure, high cholesterol, diabetes, obesity, coronary artery disease, just having just one of those increases the likelihood that you'll reach an EDSS of 6, which is needing to use an assistive device all of the time, by 6 years. What are the things we know that can help reduce the risk of those vascular comorbidities? So far, the 2 things we talked about: healthy diet, exercising, moving your body. And I've been actually prescribing the Can Do website exercise tab to patients. And I tell them to just work their way up to 22 minutes a day using Mandy's exercises. Tell them to look through all the pages. There are hundreds of them. I highly recommend doing it.
You know, in the last 5 minutes, we've talked about food being an adjunct to your MS care. We've talked about exercise, and now we've talked about other healthy behaviors. So what integrative medicine is doing is adding to your tool chest to treat your MS, which, as Megan said at the beginning, are things that are under your control. I think it's really exciting to think that the tool chest grows with each of these changes.
Okay, it's my turn. We're going to talk about sleep, but before I launch into sleep, I'm going to say a little bit about self-efficacy, and Roz is probably going to build on this. We know that those who have internal locus of control, that there are things I can do that will impact my disease course, my symptoms, my life, my joy. We do better in life. And what we are trying to impart on all of you is to exert your locus of control, your agency. And so the third area is work on your sleep. I've struggled with sleep all of my life. I have a hard time falling asleep, a hard time staying asleep. And we know that everyone with MS we often have problems with sleep. We have to get up to pee. We have more pain. We have more spasms. We have more restless legs. We have more medication side effects. If we can improve our sleep, we will have better mood, and we'll have better cognition, and we will have less fatigue. And you'll have a happier romantic partner in bed with you. And that's important too, folks. The next slide. So who can help you with that sleep? So have a regular wind down routine. I like to have a little meditation, a little prayer before going to bed. And if that's not enough, talk to your primary care provider. They can help you. You may need to benefit from a sleep study to see if there's a more physiologic sleep problem that can be addressed. A mental health provider may be helpful. And again, integrative medicine may be helpful with a little deeper investigation as to some of the other root causes for sleep disruption. Go see your neurologist, mention your sleep problems, but you can also see your primary care provider. They too can order that sleep study and make those sleep referrals.
I just want to call out the role of the mental health professional here, because many people with MS have anxious worries that roll around in their heads all night long, keep them awake. Depression is much more common in MS than in the general population, and we know that depression can interfere with falling asleep and staying asleep. So don't hesitate to call on the mental health professional to help you deal with those emotion-based symptoms that are actually interfering with your sleep.
Roz,
And-
may I just say before you move on to stress management, that the American Academy of Sleep Medicine last year changed their guidelines to say that the gold standard for the treatment of insomnia is cognitive behavioral therapy.
Absolutely.
Not
And
medicine.
Anne-Marie just said in the chat that anxiety is a given. And I think you're correct, Anne-Marie, anybody living with a chronic unpredictable illness is going to experience some anxiety. The issue is whether it's anxiety that is severe enough that it keeps you awake, interferes with your enjoyment and your comfort, and interferes with your productivity, in which case, just as with depression, it's important to get that anxiety treated so that it's something within your ability to manage, right, with some of these stress management techniques. And I think what's important about stress management is that everybody's favorite activities are different from somebody else's. This is really a trial and error process where you find the thing that helps you calm your mind, that helps you just take a rest from the stresses that are on your mind. So for some people, it's mindfulness and meditation, or combined with really good, healthy, deep breathing. Other people find their stress is best managed when they're working out and getting that physical activity. Journaling is another excellent tool that people always talk about on our programs, that when you write down the things that are worrying you and tuck them away, you sort of put them in their place so you can focus on them again tomorrow and fall asleep at night. The other thing I like that I've heard recommended on our programs is people say, okay, I'm going to give myself 10 minutes a day. And in those 10 minutes, I'm going to focus on everything that bothers me, that stresses me out. I'm going to really focus on them, maybe write them down, maybe tell a friend. And then I'm going to stop the clock and I'm going to say, okay, I can revisit these tomorrow. So it's a way to put some boundaries around worries and anxieties that can just spill over into all of your activities. And as Terry pointed out, when we get restful sleep, we tend to feel less stressed, like we have more ability to manage things, more feelings of self-efficacy. So yes, sleep helps. And again, mental health providers can help with this. They can give you lots of tools and strategies, but so can other supportive programs, including what we offer at Can Do. And the other MS advocacy organizations and mental health organizations offer stress management tools and strategies. And of course, integrative health providers like Terry and Megan are great resources for helping you manage stress.
So that brings us to a list of adjunctive therapies that might be considered or that might prescribe or perform or be considered integrative therapies. And I'll just take it back to stress for a minute. You might say, well, how can an integrative medicine provider help me with stress if they're not a mental health provider? Well, as an integrative medicine provider, I'm certified in heart math biofeedback, which is a stress management technique. I'm certified in something called neuroemotional technique, which is another stress management technique. So these things don't replace therapy, but they can help manage stress. An integrative medicine provider might be certified to do medical acupuncture or might be an acupuncturist. Dr. Walls teaches people how to be health coaches and prescribe her specific way of eating. So integrative medicine providers do more than just farm you out to other people. Most of them have many tools in their own toolboxes. We know that when you live with MS, you're living with a toolbox that's already quite full of different conventional providers. You have a neurologist, you maybe have a primary care provider. If you don't, you should. You might have a gynecologist if you're a female, a urologist or a urogynecologist, a physiatrist, an orthopedic specialist, a counselor, a social worker, all of these different people that are very important to have in your toolbox because you want them there when you need them. You don't want to have to go like digging through your toolbox, throwing things out, can't find the wrench. You want to be able to say, man, I need to go back to see my urologist and he's going to see me, not have to wait for a new patient appointment. Well, the following is true for these adjunctive therapies. So many of these people would be certified in different types of integrative or complementary and alternative therapies. For example, a rehabilitation provider like a PT or an OT or speech therapist might also hold certification with the Institute of Functional Medicine, or maybe they do some stress-related therapies like me. Maybe your massage therapist can also practice Reiki, for example. Maybe your primary care provider is certified in Dr. Wall's coaching method. Maybe your mental health provider is also a health coach or a lifestyle coach. So all kinds of things can happen in the integrative medicine world that don't require you to have to add more therapies into your toolbox, or more therapists, I should say, into your toolbox. The other thing I think that's worth mentioning is that many of these therapies can be expensive. However, many of them can be covered by a health savings account. So you'd have to check with your insurance company, but many chiropractors accept insurance. Sometimes massage therapy can be covered under the umbrella of physical therapy. Acupuncture, massage, chiropractic, even dietetics might be able to be covered through a health savings account, as can your regular conventional medical providers. So take a peek around your insurance and see what they cover that's off the regular conventional road. You'd be surprised how many more insurance providers are adding in these adjunctive therapies as part of their covered plans. So here are things to look for when you're looking for an integrative provider, or I should say maybe things to not look for, things to be worried about. If you meet an integrative provider that promises to cure your MS, I would enter with caution. Any intervention that promises to cure many different diseases, probably not the truth. A person without credentials like licensure or certification to do what they do is not someone that you want to see. You don't want to go see an acupuncturist who hasn't been properly trained, or a massage therapist who hasn't been properly trained. Some forms of energy medicine, for example, like Reiki, rules vary from state to state. But for example, in the state of Florida, a person has to be licensed to touch in order to practice Reiki. That means they need to be a massage therapist, a nurse, or other type of provider who's certified to touch, probably PTOT, but things like that. Check certification and credentials. Anyone charging exorbitant fees, they may not be in it for the joy of giving healing opportunities to others, rather they're in it for their yacht. Stem cell clinics that aren't accredited. There's a great page on the National MS Society website that can walk you through the science behind stem cell, and also some of these stem cell clinics. A provider who has no interest in collaborating with your MS care team. An intervention that has no peer-reviewed published data. And I would say that includes a supplement or an intervention that has a website that says all these wonderful things, but then you can't find the information anywhere. You can't find a link to how these things happened and where these numbers came from. Any clinic or medical business that solicits your business with freebies, like, hey, come to this dinner at this nice restaurant and learn about our treatment for your neuropathy pain or your stem cell clinic. That is happening a lot in my area. And a provider who is uncomfortable with you getting a second opinion. These are red flags to look for in integrative providers.
So now I'm really honored and excited to spend a little time asking Terry and Megan some questions about the work they do, because they are really unique in their fields and very, very gifted at what they do. So I think it's a great way to learn more about integrative medicine. So I'm going to start with you, Megan.
Yeah.
When you see a new patient for the first time, how do you begin?
So I'm always trying to practice integratively. So I begin by asking a person what their goals are. So if this is a new patient, new to MS, Are we here to talk about disease modifying therapy? Are we here to talk about symptom management? But I also want to let that person know that I'm interested in not just what's happening in their body, but also the tools that they use to empower themselves to make healthy changes. And how do they want to do that? Some people come right out and say, I don't want to take more medicine. What else can I do to help myself feel better? If they don't say that, I say, there are some other tools that I can offer you in my clinic to help you manage things like pain, sleep, stress and anxiety, cognitive issues, physical problems that we can't seem to get past. Are you interested in any of those? And so I really let the patient drive the road that we go down, and then I try to provide the evidence that I have based on what they want to do or what I have to offer them.
So just a little follow-up on that, Megan. So if somebody says things that are their goals that you feel might not be healthy,
Yes.
or in their best interest, but you want them to be working collaboratively with you, how do you help them perhaps steer their direction, or how do you provide information about what might not be a good path?
Yeah, that's a great question. So I really try to provide people with evidence or with lack thereof. And I will often ask how a person came to that path or how a person decided to make that decision. Sometimes it's based around an old fear or maybe an old experience. And then what I try to do is say, hey, let's, we're here, clean slate. Let's try to find something that satisfies that belief that you have, for which there's evidence, and I know that this is a safe option for you.
Thanks.
Yeah.
So Terry, after you and a patient of yours agree on a path, a treatment path that you want to follow, how do you then monitor the progress, their health, and their safety as they're proceeding along their path?
I encourage them to work out. Are we working on diet most commonly? And we identify the diet that they are excited about, that they can do as a family, and what are the things they're going to add, what are the things they're going to reduce or eliminate, ideally as a family. And then I have them meet with my health coach to set small achievable goals that they meet regularly with. And depending on the person, that might be once a month or once a week, and they'll meet with me every 3 months. And I will assess, are they making progress or not? And I also watch to see, are they developing peculiar thoughts about eating that become way too restrictive, and now they've developed something we call orthorexia. And then we address that. And I am mindful, if I think someone's at risk of being orthorexic, then I have very close follow-up with my health coach so that we don't have that happen.
Can you give a real quick definition of orthorexic?
Orthorexic means that I have this strong fixation that there are foods that will ruin my health. I can't have them. And I have a very narrow list of foods that I can eat. Now, I will say for myself, if I have gluten, dairy, or eggs, I have catastrophic levels of pain. So I am very rigid. I will not eat those foods because I have catastrophic levels of pain. But I can eat a lot of other things, and I do fine with that. If someone comes in with 3 things that they can't eat, I'm fine with that. If they have 50 things they can't eat, that's probably orthorexia, and we have to address that.
Okay. So one last question for you, Terry, and obviously you are a proponent of wellness and increasing people's feelings of self-efficacy. Why are those things so important to good MS care?
If we give away all of the responsibility for my health to my specialists, that I have nothing that I have to do, I get to eat crap, sit around, do nothing, and I'm going to be much more depressed. if I realize, you know what, there's stuff I have to be doing, and part of this, I'm going to pay more attention to my diet. I'm going to pay more attention to my relationships, my conversation with my spouse, with my spiritual life, and I'll move. And I will be happier. I have this conversation with my children when they were little. I still have this conversation with my children now that they're adults. And we talk about how important it is, because life will always have difficulties. And as long as you realize there's stuff that you can do that make your circumstances, however difficult they are, a little bit better, then you have high self-efficacy.
So I'm hearing two really important things, and one is multiple touch points. You don't just start to change your behavior and say goodbye to your provider. You offer multiple touch points, both of you, to see how people are doing along the way and what else they might need. And you also both give people agency to take charge of their own wellness and feel good about their efforts to help themselves. So I hope everybody's convinced how effective this kind of integrative approach can be.
I hope so too. And I'd like to, take it back to some of the things that I've been seeing come up in the chat, and even in the Q&A, people saying things like, well, I know what I have to do, but I just can't seem to bring myself to do it. Or the sweets always taste so good. Or when I'm anxious, I call DoorDash. How can working with a mental health professional, Roz, benefit a person's overall wellness, especially if they're a little bit stuck like that?
So it's a big question, Megan, and I think I'm going to tease into just a little bit of it. I think our emotions impact our behavior all the time, whether it's our behavior in our relationships, in relation to our wellness, in our work ethic. How we feel emotionally affects how much we feel able to change and take control of our lives. So one of the things that happens with a mental health professional is to talk about what are some of the ideas or attitudes or feelings that might be driving choices, right? So if there's a lot of emotional eating going on, meaning I eat when I'm stressed, I eat when I'm sad, I eat when I feel lonely, I eat when I'm tired, then adjust the process of identifying those triggers and talking through some possible alternative ways to feed oneself besides food, right? I think mental health professionals also help with motivation. And one of the things that I like to do with people is to ask them to think about a change they've made in their lives or an adaptation they've made in their lives at some point that worked, when they felt successful, and to look at what happened, why it was successful, what made it successful, what could they take from that experience and apply it to something they're trying to adapt or change now. So that's just a couple of ways that I think mental health can help a lot.
Thank you.
Sure.
In the same vein of Dr. Walls talking about how she includes the family. She believes that making a change with the family unit is a lot easier than making an individual change when other people are living differently. And I would agree that it's easier to have support on board. As a mental health professional, how does one assist with facilitating a family wellness intervention?
So the answer to that is sometimes it's easy and sometimes it's really hard. So when it's easy, it's because family members feel ready to make a change. They all share some concerns about their health or what they're eating, for example, or feeling like they're all couch potatoes and really want to find fun activities to do together or fun meals that are also healthy to eat together. And then you can actually bring them together and ask them, what kind of plan do you think would work for you? What would you like to change or incorporate that you can share and enjoy together? I think when you have one person who really wants or needs to make a change and the others aren't on board, it is very hard. And we do hear about that at MS Can Do programs a lot, where somebody says, well, you know, I really want to change the way I'm eating, and I just am finding it really hard to get my family on board. Sometimes they have to go their own way and make some delicious things that follow their new guidelines and hope that family members will taste it and think, oh my goodness, look what I've been missing all this time. I want some of that too. Sometimes you can get family members to take turns and pick a healthy meal that incorporates one or two more vegetables, and everybody gets to pick one night a week. And Terry will be very happy that more green vegetables have been added to the dish. But I think you have to try different tricks and strategies. And I think that the dietitians and integrative providers are really good at giving you ideas for how to break through the wall with your family. No pun intended, break through the walls with your family, to get them to experiment a little bit, particularly teenagers. Tough.
You know, and Roz, when people are really struggling with this, I refer my patients to family therapy, because sometimes this is really a reflection that there's unresolved family discord, and that has to get addressed.
Thank you for that. I appreciate it, Terry. I think it's absolutely true. We're getting wonderful recommendations in the chat.
Okay.
So I think it may be time for us to respond to some questions from all of you. There have been so many.
Yeah, I think that's a great idea.
Information. Let's get started with some questions. So we have someone who asked, how can I work with my primary care physician to have them help me incorporate integrative medicines into my care plan? And I'm going to pass this one to Terry.
Okay. So some of the concepts that we just talked about, improving your diet, and you can talk about getting some support for improving your diet. If they aren't excited, they can send you to a registered dietitian. You can talk to your primary care person about issues you're having with sleep, and they can order the sleep evaluation or refer you to mental health for cognitive behavior therapy for insomnia. And they can send you to the sleep specialist if your sleep study is abnormal. The primary care person can also help you find local exercise, gym memberships, exercise classes, physical therapy. So your primary care person uses these concepts in their clinical practice. And as I said, if they're not thrilled to help you eat more vegetables, fire them and look for another one.
Awesome.
Thank you. All right, we got one on mental health professionals, Roz.
Yes.
How important is it to have a mental health professional who specializes with MS?
It's a great question. I think the most important characteristic when you're looking for a mental health professional is somebody with whom you feel comfortable, safe, secure, and eager to communicate, right? You can have an MS specialist mental health professional, but if the two of you don't click, it doesn't matter, right? So obviously, it saves you a lot of time and effort if you meet with somebody who does know about MS, and you can get a referral to someone in your area through the National MS Society. And now, with the benefits of COVID, there are opportunities for online treatment, even if you don't have somebody who lives geographically close to you. And at Can Do, we can help you connect with that. But keep in mind that even if you see a person who has treated lots of people with MS, your MS is still unique. Your feelings, your needs, your family experiences, and your symptoms are yours alone. So you're going to need to spend time educating this person about your priorities, your goals, and what your MS is like in your life, even if they're an MS expert.
Great, thank you, Roz. All right, so we also have, we've got a general question about integrative medicine. Is integrative medicine mostly based on symptom management, or do they order tests and kind of dive into the specifics of MS, or is it mostly to combat symptom management? And I'll send that one over to Megan.
Yeah, so it depends on the provider who you see. So if you see me as your MS provider, I'm a nurse practitioner in neurology, fellowship trained in integrative medicine, then I'm going to use integrative medicine tools that include conventional medical tools like ordering tests and recommending disease modifying therapy to help you manage your MS symptoms and modify your disease. Because if you think back to the early part of our conversation here, you remember the slide that said recommending a healthy diet is an adjunct form of MS care. A person should have a personalized exercise plan developed. So it incorporates all of those things depending on the provider that you see. So a massage therapist, for example, is going to help you with an MS symptom, not disease modification or slowing down progression of disease. Although regular massage therapy may significantly help you with spasticity or pain. So perhaps you could get off some symptomatic medications. So it just depends on the provider you see. I hope that helped answer the question.
Paige, I'd like to add on to that.
Absolutely.
Well, I think we should also talk about the role of primary care in treating the comorbid problems. If someone has prediabetes, metabolic syndrome, insulin resistance, high blood pressure, obesity, they have more aggressive disease. And these comorbid problems can be addressed by your primary care provider and your integrative and functional medicine practitioner may be willing to be a little bit more aggressive or root cause based as to how I can help people get a better control and improve their insulin sensitivity. And depending on the skill level, your primary care can do a great job with that, or an integrative functional medicine trained practitioner can also do a great job with those things.
Great, thank you so much. We have a lot of questions just around integrative medicine in general and asking about misconceptions. There's lots of things out there on the internet of what you should do, what you shouldn't do. Can each of you kind of talk about some common misconceptions of pairing integrative medicine with conventional medicine and how that's kind of been a part of your life and how you move forward with your patients? Terry, I'll let you go first.
So, when I first started doing functional medicine, I was at the VA and I could do no testing whatsoever. I could just talk about diet and lifestyle. And I found that we really had remarkable success. And that led the VA to pull me out of primary care and let me create my own new clinic. We called the Therapeutic Lifestyle Clinic. And now I can do very basic labs, lipids, glucose, vitamin D, homocysteine, and that was it. And I could still talk about diet and lifestyle. And now I had a dietitian to work with. And we had tremendous results. And now I've left the VA, I have my own private practice. And so now I can do more in-depth functional medicine testing and offer more specific guidance. But we could still get really great results by these simple lifestyle interventions that we talked about here. It depends on what you're looking for. Are you looking for these lifestyle recommendations that you control, or are you looking for more thorough testing, and that would be more expensive and more expensive supplements? It depends on what the individual is looking for. But I would say 90% of the results you're going to get will be from the diet and lifestyle interventions that require very minimal testing in order to develop a good recommendation and a good plan for you.
Keep it simple.
And yeah, so I will extrapolate on that in that probably the most common misconception is that you need to have thousands of dollars worth of lab work done and take thousands of dollars worth of supplements to heal. And by healing, I'm not talking about curing MS. I'm talking about, healing is possible even when a cure is not. And that is just not the case at all. And in fact, an integrative or functional provider who tells you that you need to have thousands of dollars worth of tests done and take thousands of dollars worth of supplements in order to feel better is kind of a red flag provider. I think that is, in my opinion, the most common misconception about integrative or functional medicine. And the crux of what we want to offer to you are these lifestyle changes. You can't substitute supplements for prescription medications and think you're going to get better if you're not making lifestyle changes. So it really comes back to that empowerment of you making simple things in your life. Like Dr. Wall said, adding vegetables in, hoping you push other things out, addressing your sleep and your stress issues and watching somehow your pain get a little bit better, or your eating and taking things out of your diet that are inflammatory and watching your pain get a little bit better. Because it's almost like pouring water on a boat with a big hole in it. You can keep pouring all the water on, but until you patch up the boat, and scars are beautiful, patches are beautiful. Until you patch up the boat, you're not floating, right? So I think one of the biggest misconceptions is that you have to do these expensive things to feel better, and you really don't. I also just want to address real quick as it relates to expense. I saw someone say, but isn't it expensive to eat this way? So first of all, you don't have to eat all organic foods. Dr. Wells, I think you're going to comment here. Yeah.
I want to jump in. I taught people in the VA living on food stamps how to basically implement the protocol that I use for my recovery, the modified paleo diet. Living on food stamps in rural Iowa, rural Missouri, shopping in small town grocery stores. And we did teach them how to do vegetarian meals, beans and rice. We taught them how to go to the local, because in Iowa, there's too many deer. We shoot them. We have controlled hunts, and you get communities give away venison. And so it's easy to get some meat free that way. And they were very successful, extraordinarily successful. I really disagree that costs more money to implement these concepts. Exercise doesn't cost more money. Meditation doesn't cost more money. A routine before going to bed doesn't cost more money. Getting rid of the sugar, the processed foods, the fast foods doesn't cost more money. Eating beans and rice is very inexpensive. Cabbage is pretty inexpensive.
And from a mental health perspective, it's interesting to me how much I've learned about integrating different aspects of health and wellness into mental health care, right? When I went to graduate school, you saw mental health care as something that happened on its own in isolation when somebody had some kind of discomfort or disorder. But I think what we're learning is that in order to optimize wellness, mental health has to be integrated along with all of these other strategies that Terry and Megan are talking about, because mood impacts them and they impact mood. So it's kind of a package. that we're suggesting you put into your tool chest to optimize what each of your providers has to offer and what each of these different interventions has to offer.
Absolutely. Thank you all so much. Well said. We are out of time for this evening, so just because it's over doesn't mean your questions aren't going to get answered. Please join us for Jumpstart and YQA later this month to get those questions answered. Please connect with us on social media. That's where you can find out upcoming programs, resources, as well as MS News. You can also register on our website for the e-news series that goes out every month. Go to our website at cando-ms.org. Join us next month for what to know more about diet and MS, and we'll dive farther into the diet conversation. And thank you so much for joining. Panelists, thank you. You've been great this evening. To everyone who joined, when you leave the webinar, a survey will pop up automatically on your screen. Please take a few minutes to fill that out. It does help us make the best possible programs for you. Thank you to everyone and have a great night.